Our program's reach allows us to connect with viewers in places like the Walla Walla Valley. For a few years now, Providence St. Mary Medical Center has expanded its heart care capabilities to include emergency treatment of heart attack. This connection further enhances cardiac care throughout Southeast Washington and Northeast Oregon. And patients in the Walla Walla area recently got important education on heart health when the St. Mary Cardiac team hosted a luncheon and educational program. A room was filled with Walla Walla area residents who wanted to learn more about living heart-healthy lives. It was billed as a Love Your Heart lunch, and no one was more thankful to be there than Morris Jones, who has overcome multiple serious heart ailments. Morris has lived with heart issues his entire life, so his humorous message of prevention was extremely valuable and well received.
2 operations later, they've taken about 80 years worth of cheeseburgers out of my carotid arteries.
It complemented the advice provided by cardiologists and nurse experts from the Providence St. Mary team, including Jane Casey, who works in cardiac rehab and herself knows firsthand what it's like to have open heart surgery.
You've got to trust your heart, and a lot of us, our cardiac situation, it took us by surprise. And your heart's a vital organ. I mean, you need that thing, and you need it to work. And you have this trust relationship that it was going to be there.
Doctors Maksud and Wong have been practicing cardiologists in Walla Walla for several years. In recent years, interventional cardiologists like Lisa Abrams joined the team as St. Mary began an around-the-clock program to treat heart attack patients using angioplasty and stents.
When you're having a heart attack, every minute counts. And so if you're having a heart attack and you have to be transferred to another institution, those minutes increase your risk of dying and increase the amount of damage that will be done to your heart. And I came from a big program where about 70% of our care was given to transfer in patients, and the farther they came, the worse they did. And there is just no two ways about it. If you can get your care in your community, you're better off.
The education received by the luncheon attendees was well received. All urged to work on controlling their lifestyle habits that contribute to good heart health. And as important, act on heart attack symptoms right away, knowing expert care is close by.